Hi doctors, my name is Dr. Lama and the topic today is scoliosis surgery. The definition: scoliosis surgery repairs abnormal curving of the spine. This goal is to safely strengthen your child's spine and align your child's shoulder and hips to correct your child back problem.
Progressive thoracic idiopathic scoliosis. You can see that the lateral X-ray shows that there's a significant hypokyphosis or loss of hypokyphosis, which is typical of idiopathic curvatures. You can see the lumbar compensatory curvature is highly flexible, and this allows us to do a selective thoracic fusion in this case, the thoracic curvature being this.
Application in medicine. Before surgery, your child will receive general anesthesia. This will make your child anxious and under feel pain during the operation.
Addressing the thoracic curvature, a subperiosteal dissection of the spine is performed, exposing the transverse processes and the facet joints and the midline ligamentous structures. The interspinous ligaments are removed with a Lexel rongeur, as shown here. And then at each segment, facetectomies are performed, which have already been done. And now I'm performing Ponti osteotomies, in which the intersegmental resection of the ligamentum flavum and the superior articular facets are removed. This was described by Alberto Ponti initially, originally.
During surgery, your child's surgeon will use steel rods, hooks, screws, or a metal device to straighten your child's spine and support the bones of the spine. Bone grafts are placed to hold the spine in the correct position and keep it curving again.
Efficiency. So at the proximal and distal ends of the construct, I use a polyaxial screw mobile in all directions, and at the intermediate segments, I use the uniplanar screws. Again, this enhances our ability to correct rotation. And so here, moving my way up the spine in a cephalad direction, placing screws segmentally at each level, gives us maximal control of the curvature. And the key is to place these harmoniously so that the uniplanar screws line up in a harmonious fashion.
The surgeon will make at least one surgical cut to get to child's spine. This cut may be in your child back, shed, or both places. The surgeon may also do the procedure using a special video camera.
We pack the wound with rolled sponges and really maintain hemostasis. After using a 2mm drill, I then go to a 2-point.
During the surgery, the surgeon will move muscles aside after making the cut. The joints between the different vertebrae, the bones of the spine, will be taken out. Bone graft will often be put in to replace them. Metal instruments such as rods, screws, hubs, and wires will also be placed to help hold the spine together until the bone graft attack and heals. The surgeon may get bone for the graft in these ways. The surgeon may take bone from another part of your child's body. This is called an autograft. Bone taken from a person's own body is often the best. Bone can also be taken from the bone bank, much like a blood bank. This is called an allograft. These grafts are not always as successful as autograft. Man-made bone substitute may also be used.
A sign that blood pressure is low, or that the patient's hemoglobin may be low, and so we inject.
Why the procedure is performed? There are also several reasons to treat scoliosis. Apparently, this is a major concern. Scoliosis often causes back pain. If the cure is severe enough, scoliosis affects your child's breathing.
Bony margin around the screw. Here we check with fluoroscopy. So after I've placed the screws in a freehand technique,
Risks. There may be complications with any of the procedure of scoliosis repair. Risks for anesthesia are allergic reaction to medicine, breathing problems. Risks of surgery are bleeding, blood clots in the legs that may travel to the lungs, heart attack or stroke during surgery, infection including in the lungs, pneumonia, bladder or kidney.
The rod and the proximal screws, I'm able to cantilever the rod distally into the lower screws of the construct. And we place the rod in the coronal plane, taking advantage of the sagittal bends to enhance the ease or to make it easier to insert. And we'll use the old-fashioned, quotes, old-fashioned hook holders to pull the
Thank
spine
you.
to the